Alrighty, my name is Bianca Santiago. I'm going to be presenting on Huntington's disease today. So, Huntington's disease, also known as HD, the first case was reported in 1842. It wasn't until 1872 that George Huntington actually named this disease as Huntington's chorea. And it's a rare disease of the central nervous system, a rare deteriorating disease, and it affects an individual's mental and physical capabilities and their activities of daily living. It is a autosomal dominant disease, meaning that one of the parents who possesses the abnormal gene has a 50% chance of passing it down to the child. So the child, basically, if you have one parent with an abnormal gene, you have a 50% chance of inheriting this disease. And it affects multiple areas within the brain, deteriorating. The primary thing that gets deteriorated is the neurotransmitters. So if you look here, like if that's the signal being sent and there's a damaged neuron, it interferes with certain signals being sent throughout the body. And most of the decrease in neurons is in the cortex and the striatum of the brain. Because it's a genetic disease, the gene for HD was discovered in 1983. It's called chromosomes 4p16.3. When they found that gene, it was very important because they could then identify where or how people got the disease. If you look here, the DNA is made up of a trinucleotide, which is the building blocks of the genetics, and inside of them there's codons, which are like the letters that you usually see in sets of 3. So an abnormal the codon for HD is CAG. So this is a normal one where there's only usually 6 to 26 repeats. This is an abnormal one, all these extra, that's someone with Huntington's disease. And usually if someone has 36 or more of the repeats, then they're going to get Huntington's disease. The average, once again, is 6 to 26 or 10 to 26, depending on where your information comes from. So the codon repeat, the longer codon you have, the earlier onset of the disease. Juvenile Huntington's disease is diagnosed when symptoms appear before the age of 20. So, and then there's, if you have 36 to 39 repeats, it's called incomplete penetrance, which is you have the disease, but you have an abnormally late onset of it. So you won't get it until later in life, which is, I would think, better, but still unfortunate. And then if you have more than 40 of the repeats of the CAG codon, then HD development is a definite. And once again, here's just someone who drew the same thing as before, but here they showed the brain, how you can see certain cortexes deteriorating. This hole got bigger. There's more little openings throughout here. So that's this just deterioration of the brain. All right, to diagnose it, usually the first reason why they would try to diagnose it is if one of your parents have the abnormal gene, then they do something called preventative testing, which you don't have to wait for symptoms to appear. They'll automatically test you. They'll do a genetic testing to see if you have that codon repeat and have the disease. So that's good that you don't have to wait for symptoms to arise. And they also usually get a detailed personal and family history just to help out with the diagnosis and things like that. Signs and symptoms. So the most common symptom is involuntary movements. It usually starts distally, like in your fingers, and then will travel proximal to your proximal extremities and your trunk. So this is called chorea. This is where the Huntington's chorea comes in. The choreatic movement is the uncontrolled movement of your body. And there's also psychiatric changes There's a lot of irritability, anger, depression, things like that, because people are not used to having these things change in their lives. And skin injuries and infections are also common because of the uncontrolled movement. Some people tend to fall, some people might get friction within certain body parts, so you have to be aware of especially infections. And then there's also cognitive problems, dementia. People have problem solving skills, just making everyday life decisions. It becomes difficult for them. They also start to have some memory loss. And then some other more common symptoms are weight loss. You have trouble sleeping. There's sometimes fractures and head trauma from the falling and gait problems. And then towards the final stages of it, people tend to have difficulty breathing and swallowing. Disease progression. So in the early phase, people just tend to start moving slower. They start to having that choreatic movement, and then problems like minor problems with decision making and mental problems. And then they also tend to become a little more irritable because of the new changes that they're not used to. In the mid phase, they have gait and balance issues. They tend to start falling, and then they might need assistance with certain activities of daily living in their lives. And in this phase, they also tend to see more anger because, especially when you're starting to become dependent on others for functions throughout your life, that can get a great emotional response. And then in the final phase, people become fully dependent for all activities of daily living. They have problems, like I said before, breathing, speaking, even swallowing becomes challenging. But they did note that they can still take in information and comprehend everything that you're saying. They just don't have the best output to respond back to you. So they're not a vegetable. And a unified Huntington's disease rating scale, which is UHDRS, is often used to track the regression of the disease. So that'll help identify the different stages of which the patient is in. And then this is just another chart basically summarizing what I just said. Treatment. So there is no cure for the disease, unfortunately. The best they can do is try to control the symptoms that you have for the disease. So medication is the best treatment. There's a medicine called tretibenzine, also known as TBZ, which is a common drug used for the choreatic movements and helps to slow down the depletion of the neurotransmitters. And dopamine, glutamine, and Y-aminobutyric acid are thought to be the most affected neurotransmitters in HD, so a lot of pharmacists are focusing on medication to help with those neurotransmitters. And when doctors are prescribing these medications, they want to make sure that they are aware of the side effects of it, because a lot of people already tend to have depression, irritability, certain things like that, and a lot of drugs have depression and stuff like that as side effects, so you don't want to make anything worse. And then they also said a good treatment for it is certain hobbies picking up, like they listed things like music therapy, exercising, dancing, playing video games, stuff like that, things that just kind of make you happy, keep you going in life. And physical therapy and Huntington's, the main reason why people come to us is because of their gait and balance issues once they start to progress in the disease. And that's also one of the main reasons why they end up in assisted care, because they need help with everything that they do. For physical therapy, it's a lot like a conditioning program overall. They do aerobic exercises, they'll do stretching, they'll do strengthening, they'll do proprioceptive, coordination, balance, things like that to improve your posture, your strength, just maintain an overall healthy life for as long as you can until you start progressing later into those phases. And you also want to teach any friends, family, or home caregivers how to help people with transfers, how to help them use assisted devices, because they will eventually be limited to things like that. So it's good to instruct others on how to basically make the patient's life just easier by helping them out with their devices. And there was a couple case studies I ran across. The first one had 12 patients. Each patient had 6 weeks of therapy. It was 1 hour per treatment. They started with a 10-minute warm-up. They did different transfer techniques, gait and balance, posture exercises, coordination, and then they always ended with 10 minutes of relaxation, which I thought was pretty cool because not many do that. And then they used something called a gait right mat, which is from Berg's. It's called Berg's gait right mat. And basically it's a device that assesses a person's gait by using their stride length and their velocity of their gait. And the final score is getting from the amount of time that both feet were on the ground during the gait cycle, so it assesses your gait pattern. After the 6 weeks, the patients improved with their base support, but not so much the posture. So they said that the velocity increased and they had a longer stride gait, which I think was really good because greater base support is better balance. And another case study, there was 49 subjects, there was 3-week periods. They repeated it 3 times a year for 2 years. They did a variety of exercises. They didn't really list it. It was respiratory, speech therapy, physical therapy, and occupational therapy. They had questionnaires that they had people fill out each visit so they can further understand what they were going through. And then for this one, an article from the PT intervention for people with Huntington's disease, they said that with the right plan, that it has been proven to reduce the manifestations and improve overall quality of life of patients. And the last study, there was 30 people all over the age of 18. All were diagnosed with Huntington's disease. 13 of those 30 people were randomly picked to also participate in an exercise training group. And then there was 20 healthy individuals who had similar age and gender that were used just as a comparative to compare the results. So they had the treatments were from 9:30 to 3 in the morning, 3 in the afternoon, and they used Borg scale to measure the exertion level of the patients. It started with 2 phases. The first phase was 3 minutes cycling, and they wanted the max heart rate to stay between 60 and 70. The second phase was an additional 6 minutes on top of that 3 minutes, and they wanted the max heart rate to stay between 70 and 80. And then as a result, they said that people may gain health and well-being benefits from exercise participation, and that's the early and mid phases of Huntington's. So just a couple statistics. The average onset of the disease is between age 2 and 85, with the most common symptoms being between the ages of 30 to 50. The average duration of the disease is usually 17 to 20 years, and then, like I said, it's terminal. It's more commonly seen in Caucasians. 5 out of 10 out of every 100,000 will develop Huntington's disease. And it's a terminal disease, but the most common side effect, cause of death, is pneumonia followed by suicide, which I thought was pretty interesting. Especially the suicide, you have to watch for the side effects of the drugs, because, yeah. So in conclusion, it's a very devastating disease, not only for those who have it, but the people that are in their lives around them, because they have to help take care of them and, keep them going. It has no cure. It is terminal disease, but they believe that with early intervention, PT intervention, and just maintaining overall health in those beginning stages, taking meds for your symptoms, they think that PT is good for it. So, those are my resources. Any questions?